All right, so hip rotations on your back is an opportunity to find stability for your core, to work on your deeper hip flexor muscles. So the ones that are just integrated within your core, the iliopsoas, and also to find a little more mobility through the hip. And so if we're starting in this 90 degrees with our hip flexor, you can allow the foot to rest. So coming up here might actually give you a little bit of that rec fem, so that weaker hip flexor through the quad irritation. So let that knee bend. And then you can just start with a rotation through the joint. So a circle. So what's important here is that you're not falling off with your pelvis. So you're just really trying to use the movement of the hip rather than finding that you're bracing with the left side back, in which case might irritate you. So that movement might be very subtle for you. Press through the left foot to find stability, or through your arms. Keep your core engaged. Now, if that feels doable for you without compensating and finding irritation through here or side flexing through there, if you can maintain this core stable so it's not moving through rotation, then coming into an extension, coming up into rotation. You can come out as far as you're able, back into extension. Reverse the direction. You may find things get a little bit sticky. So you're aiming for smooth movement, but you'll find that after 10 repetitions, you're going to get fatigued through the left side that you're stabilizing with, through the right side. Stop only if you're feeling lower back, a side joint, or hip flexor pain. We do want this control to translate eventually to lots of stability and control in a standing hip rotation, but we're not going to go there right away because this again is challenging a lot more things. But the exercise we just did will also help to engage the core. So it is some motor retraining because things are challenged quite a bit through this area, so it is not uncommon to get a spasm if we're fatigued. And so we want to really get the assistance of the deeper rotators that sometimes get neglected, as well as that deeper hip flexor. All right, I hope this